is very important to follow instructions properly before the surgery for a good successful surgery and not to have any complications or mishaps during the operation. So, on the previous day itself, the patient should have light food, should not have anything very heavy, spicy, not to have any food outside, because unnecessary infections at the last minute is not good. So, we recommend a normal breakfast, a light lunch, and trying to have a very light dinner on the previous day. Patient should preferably be on semi-solid diet after lunch in the afternoon, and there are a few medications that need to be taken in the night. Normally the doctor would have prescribed this, either the anesthetist or the surgeon, and these tablets should be taken along with the normal medications. But in the normal medications, there may be a necessity to stop some of them, like patient is on insulin, probably we do not give insulin on the previous night. Patient is on blood thinners, this is a very important thing. They should stop blood thinners before the surgery, and it could be even up to 1 week before the surgery. Sometimes we may have to replace it with certain injections, and all these instructions should be taken from the primary physician or a cardiologist along with the surgeon, and should be very strictly followed, because patients on blood thinners, if they are operated, can have a lot of bleeding. Apart from this, there are other medications like painkillers which are being taken by patients, which should be mentioned, and there are certain medications which can never be stopped. Though the doctor says empty stomach, those tablets are a must to be taken. And normally after 10 o'clock in the night, the patient has to be in empty stomach and come to the hospital in the morning in empty stomach. It is also important to remove nail polish, because the anesthetist and the doctors will be looking at the color of the nails during the operation, and this is a very important procedure that has to be followed. Shaving is normally not very much required during laparoscopic surgery, and if there is any specific instructions, that will be given by the hospital prior to admission itself. There are certain procedures like a diabetic has to take diabetic medications in the night other than insulin, but there are certain tablets like thyroid tablets, BP tablets, and certain other things like patients having fits and anti-epileptic medicines and some others have to be taken even in the morning before surgery with very minimal water. So, this should be taken at least 3 to 4 hours before the operation. A patient has to arrive at the hospital at the particular time he has been instructed to come. This may not be the time of surgery, because there is a whole lot of things that needs to be done after the patient arrives in the hospital to the time of surgery.